cardiologist, a medical student, and a patient walk into a clinic. Sounds like the start of a joke, right? But in this case, it's the start of a journey into the world of cardiac catheterization and angiography. Meet Dr. Harris, a seasoned cardiologist with decades of experience under his belt. Then there's Benjamin, an eager medical student, eyes wide and mind ready to absorb every bit of knowledge he can. And finally, we have Alice. Alice is not a doctor or a student. She's a patient who's been experiencing worrying symptoms recently. Together, this unlikely trio is about to embark on a journey of understanding and discovery. A journey that will take them deep into the intricacies of a complex medical procedure. So buckle up as we dive into the world of cardiology with Dr. Harris, Benjamin, and Alice. Dr. Harris, with years of experience under his belt, begins to explain the disease and procedure to Alice and Benjamin. Now let's talk about cardiac catheterization and angiography. Dr. Harris starts. This is a procedure that helps us obtain vital information about the heart and blood vessels. Like most medical procedures, it carries certain risks: vascular injury, renal failure, stroke, and myocardial infarction, to name a few. The mortality rate, however, is quite low, ranging between 1/10 to 0.2%. He continues, this is an invasive procedure, meaning we introduce catheters into the arterial and venous circulation under conscious sedation and inject a contrast substance. The arterial access is most commonly via the femoral artery, though the radial approach is gaining favour, especially for obese patients and those who are dependent on driving and ambulation. Venous access, on the other hand, is through the femoral vein or the internal jugular vein. Dr. Harris then goes on to explain that it's a same-day procedure as an outpatient, with certain prehospitalization indications such as anticoagulation, renal failure, diabetes, and a contrast allergy. The catheterization procedure allows us to directly measure intracardiac pressures, transvalvular and mean peak pressure gradients, valve areas, cardiac output, shunt data, oxygen saturations, and visualize coronary arteries, cardiac chambers, and great vessels. Dr. Harris further clarifies, angiography can provide valuable information regarding lesion severity, complexity, location, and prognosis. However, it's contraindicated in severe renal failure due to contrast agent toxicity, hence the importance of checking renal status. He also touches upon right and left heart catheterization, explaining how they record different pressure values and measure cardiac output. He also mentions how coronary angiography accesses the coronary vasculature via the coronary ostia. As Dr. Harris wraps up his explanation, both Benjamin and Alice feel more enlightened about the procedure. His voice is steady, his explanation clear and to the point, making a complex procedure much easier to grasp. With the basics covered, Dr. Harris takes a deeper dive into the procedure, explaining the different types of catheterizations. He starts off with right heart catheterization, also known as the Swan-Ganz catheter procedure. Here, right atrial, right ventricular, and pulmonary artery pressures are recorded. He delves into the importance of the pulmonary capillary wedge pressure, obtained by advancing the catheter to wedge in the distal pulmonary artery. This method records pressure measured from the pulmonary venous system and, in the absence of pulmonary venous disease, reflects left atrial pressure. Moving on, Dr. Harris explains the left heart catheterization procedure. Here, systolic and end-diastolic pressure tracings are recorded. It's also possible to assess the left ventricular size, wall motion, and ejection fraction by injecting contrast into the left ventricle via femoral or radial artery catheterization. He emphasizes the role of cardiac output, which can be measured by the Fick oxygen method or the indicator dilution method. To round off the topic, Dr. Harris introduces Alice to the concept of coronary angiography, a procedure in which the coronary vasculature is accessed via the coronary ostia. He points out that this procedure is contraindicated in severe renal failure due to the potential toxicity of the contrast agent. Therefore, checking renal status is a crucial part of the pre-procedure preparations. Dr. Harris's detailed explanation helps Alice understand that these procedures are not as daunting as they may initially seem. They are guided by meticulous protocols and are designed to provide precise and valuable information about her heart's condition. This information, in turn, guides the best course of treatment, tailored specifically to her needs. With a thorough understanding of the procedure, Alice feels more prepared for what's to come. She appreciates the depth of knowledge and expertise that Dr. Harris brings to the table. This deeper dive into the procedure not only demystifies it, but also reassures Alice that she's in capable hands. Scene script. Dr. Harris moves on to discuss the diagnostic aspects of the procedure. Diagnostic catheterization, he begins, is a sophisticated tool in our arsenal that allows us to directly measure intracardiac pressures, valve areas, cardiac output, shunt data, oxygen saturations, and it also enables us to visualize the coronary arteries, cardiac chambers, and great vessels. It's a critical component of the cardiac catheterization process. Dr. Harris continues, however, like any medical intervention, it comes with its own set of complications. Although rare, complications do occur in less than 1% of cases. These might include vascular injury, renal failure, stroke, or myocardial infarction. He then proceeds to discuss the different provocative pharmacological agents that can be used to unmask pathology. In some cases, he explains, we may need to use certain agents to reveal hidden or latent pathologies. For instance, fluid loading can help us to detect latent pericardial constriction. Similarly, afterload reduction or inotropic stimulation can be used to increase the outflow tract gradient in hypertrophic cardiomyopathy. Dr. Harris also mentions the use of coronary vasoreactive agents such as methylagonovine and acetylcholine, and a variety of pulmonary vasoreactive agents in primary pulmonary hypertension. He emphasizes, these agents help us to understand the severity, complexity, location, and prognosis of the lesion. However, they are used judiciously and under careful monitoring, as they could potentially cause an adverse reaction. Moreover, he adds, inadequate diagnostic procedures occur in fewer than 1% of cases. This is why it's so crucial to have a skilled and experienced team performing and interpreting the procedure. Finally, Dr. Harris reassures Benjamin, it's important to remember that every patient is unique, and the approach to diagnostic catheterization should be tailored to the individual's specific condition and overall health status. As the discussion on diagnostic catheterization comes to an end, Benjamin feels more confident in his understanding of the procedure. As the conversation draws to a close, Dr. Harris reiterates the key points. He underscores the multifaceted nature of cardiac catheterization and angiography, a procedure that allows direct measurement of intracardiac pressures, valve areas, cardiac output, and more. He stresses the importance of understanding the risks involved, such as vascular injury, renal failure, stroke, and even a minimal mortality risk. The procedure, while invasive, is typically an outpatient same-day procedure, with the arterial access most commonly through the femoral artery. Renal status is vital due to the potential toxicity of the contrast agent used. Dr. Harris also highlights the significance of diagnostic catheterization, a critical aspect that aids in unmasking latent pathologies, with complications occurring in less than 1% of cases. In conclusion, he emphasizes that every patient is unique, requiring a thorough, individualized consultation with a professional. With a final word of advice from Dr. Harris, Alice, Benjamin, and our audience, step out of the clinic, better informed and prepared for the world of cardiac catheterization and angiography.